we will leave no stone unturned. There is a new sheriff in town, I promise you. If you're cheating the American people, we will come after you. And if you're doing it to hurt folks who are most vulnerable, we'll be doubly vigilant at that.
There's a new sheriff in town. His name is Dr. Mehmet Oz. He is the administrator of CMS, and he's responsible for the health care of 150 million plus Americans. In his new role as administrator, he is going to lean into technology, into AI, and deliver medicine in ways that have never been delivered before. But the big question is, who's going to pay for all that? Well, that's what we asked him in the latest episode of Decoding Retirement. Take a listen. So welcome, Dr. Oz, to Decoding Retirement. We're happy to have you here.
Thanks for having me. Lots to talk about.
We do have a lot to talk about in a short period of time. So let's start here. You mastered the art of explaining complex medical concepts to millions of people on your television program. And now you're running a complex agency with where you're responsible ultimately for the health care of millions of Americans, 150 plus million Americans. And curious, what's your strategy for translating that, that same clarity to an agency where a single memo could affect 66 million Medicare beneficiaries or 78 million Medicaid beneficiaries or millions of people on ACA? What's the strategy?
Well, the one job you didn't mention was being a heart surgeon. And actually that as well has some overlap with hosting a TV show and running a government agency. There's different amounts of blood in each category. I may be in the bloodiest terrain right now, the harshest theater. But I do believe it's the best job I've ever had, in part because much of what I've done in my life, and I do adore heart surgery, and hosting a show was just a blissful event every single day. But much of what I do now is to take those skills and allow them to be, affect billions of Americans, as you mentioned. Many times those Americans feel like they've been left behind. At my very core, what I've always felt was I wanted to be in the change business. A lot of listeners probably feel the same way. You don't just want to go up every day and do your job and go home. You want to get up and do things that change the course of human history. At least we like to think that. And that's certainly what I think all of us are put on earth to do, is make a difference. So within this space of healthcare, there's many ways to do it. But something that I learned from my producers on the show, and it's a very powerful insight, is people do not care what you know until they know that you care. Mm-hmm. And so starting off with the emotional hooks about why this message matters and why what we're doing is so important is the best way generally to start any conversation. So with your permission, I want to just share a quote that's present at the entrance of the building that I work in with Secretary Kennedy and a bunch of other colleagues in Washington. It's called the Humphrey Building. And Hubert Humphrey made this statement 50 years ago. By the way, Medicare and Medicaid, 60 years old this week, which we'll talk about. So this precious gem, this backbone of the social safety net system was created 60 years ago. And because of drift or maybe by design, there have been lots of changes to the program. But we should always remember this quote from Hubert Humphrey. And it emphasizes it is the moral obligation of government, the moral obligation to take care of those at the dawn of their life, the children, those at the twilight of their lives, the seniors, elderly, and those living in the shadows. And that haunting use of light that Hubert Humphrey was proposing, we judge the purposes of Medicaid in particular, but it applies to Medicare and CHIP, the Children's Health Insurance. It applies to the Affordable Care Act. It even applies to commercial insurance, which we don't control, but private companies offer to their employees. That's the goal. That's what insurance is about. We pool our resources. We pray we don't get sick, but if we happen to have the bad luck of an illness, then you have to manage that. And that's fundamentally why all this that matters. And retirement is made much richer if you're healthy enough to enjoy it. You cannot be a healthy country if you're not if you're not doing these issues, and you can't be wealthy if you're not healthy. It matters that Americans are healthy enough to live and work longer. And I'll give you one math, just tangible example. If you were born in 1964, you are now 61 years of age. It turns out the average American retires at age 61. So if I can get you to work an extra 3 years, from 61 to 64, the value to our GDP is $1 trillion. $1 trillion just by one group of people born in 1964 working 3 years longer. So that means we got $300 billion in taxes from that $1 trillion of incremental value to the GDP. So this is how I think about the investment in health. If we make America healthy, we will be a richer country for it, literally.
Yeah, there's a lot of talk now about increasing health span, compressing morbidity, et cetera, et cetera. But you mentioned the Humphrey quote, and I'd love to turn your attention to the One Big Beautiful Bill, where there's some controversy around how many people might not qualify for health insurance or Medicaid, given the potential work requirement that will be put in place. I'm curious, your thoughts on that. Like, for me, as I think about all that I've read about this topic, is most of these folks are working either full or part-time, and it might be the red tape, right, that sort of bogs them down from getting the health care that they need. And in light of what you just said about Hubert Humphrey, it seems like we might not be fulfilling that promise.
Excellent place to go, because I think it highlights some of the arguments that happen in healthcare. So the primary goal of Medicaid was to take care of the people identified by Hubert Humphrey. None of those categories are touched by the work requirement, because it's not even a work requirement, it's a community engagement. Are you willing to commit to try to get a job, get an education, support your community, take care of kids, do something that shows that you actually have agency over your future? So if you're in one of those early categories, if you're a child or seniors in poverty, or if you're living in the shadows because you've got a chronic illness or some other reason that you can't work, you're already in. The purpose of what was done to take the fraud, waste, and abuse out of Medicaid was to preserve it. The expenses have gone up 50% in 5 years. That is just not sustainable. And so rather than shut the program down in some future administration, the president said, clean it up. Take out the stuff that's not supposed to be there. The most obvious was a work requirement, which most people, if they think about it, and this has been surveyed, 100% agree. If you're living in someone's home and they come home at night after they worked all day long, and they're paying your health insurance, and they say, will you chip it? Because, like, help around the house, try to get a job, go get an education. Don't do what you're doing now, which is on average an able-bodied person on Medicaid, who was never supposed to be on Medicaid originally. An able-bodied person on Medicaid who's not working watches 6.1 hours of television or video games or just hang out around the house a day. 6.1 hours a day. That's not a way to live your life. And it turns out, when you give the American people that challenge, and I have confidence in the American people, I suspect you do too, most listeners as well, they take it. When over the last year and a half or so, there have been 15 million people who have come off the Medicaid rolls, who were left on there during COVID because nobody was asking questions about whether you belong on Medicaid. Of the 15 million people, 90% got other coverage somehow. So the average American understands it's a sweetheart deal to get free health insurance, especially if all we're asking you to do is make your life better. Right. And that's why I am confident it's ethically and morally the right thing to do, but it also will help preserve a program so the people that Hubert Humphrey spoke about, the people for whom 60 years ago Medicaid was created, they're protected. And you know why there wasn't a work requirement back then? It never dawned on anyone's mind that you would ever give free health insurance without asking people to try to chip in if they were able to. And if you look at every other social program, we have work requirements. In fact, President Obama, President Clinton, President Biden all said, Democratic presidents, as well as Republican presidents, obviously, have all said that the backbone of a social network program, of a social safety net program, is a work requirement. It's good for the people in the program. And the welfare reforms of President Clinton back in the 90s showed that when you challenge people, they get jobs and they get out of poverty.
We're going to take a short break. We'll be back with Dr. Oz, the head of CMS, right after this. Yeah. I'm curious. There was a report recently that talked about in Georgia where there is a work requirement, and how people who are working but who failed to fill out the paperwork then became disqualified. Do you worry that maybe that impediment, that red tape, would prevent people from qualifying for Medicaid who might otherwise qualify but were it not for the paperwork?
So we are so focused on that issue, we've already launched 2 pilots in Louisiana and in Arizona which have had good results so far, and we're going to broaden it out. I was speaking this weekend to the National Governors Association, and I asked a few more states to join the pilot. The people running it are the same folks who fixed the passport system in America. If you haven't tried to get a passport recently, there was actually a positive article about the administration in the New York Times because the passport system works now. Within 2 to 3 weeks, you can get a new passport. You don't have to go to a post office or a drugstore for photos. It's all done digitally. So we have the same team run by Amy Gleason, United States Digital Service, and they have already started the pilot. And it's very simple. 91% of people on Medicaid have smartphones. You tap on the smartphone within the app where you're working. Let's say you're an Uber driver. It knows that ADP does your payroll. And so it asks you permission. Can I contact this ADP company and ask them about your hours? You say yes, and boom, within 5 minutes, the entire process is less than 7 minutes. You have all your numbers. You just confirm that it's okay. And I'll go one step further, Bob. This is what I'm excited by. And I talked about this with the governors this weekend. Into that system, let's make it better. Let's connect you to the employment office of the state if you haven't gotten to 20 hours. So again, we're only asking you to work half-time. You don't have to work full-time, even if you're able-bodied. Just 20 hours a week. But if you're short 3 hours, maybe we can get you a job in an area that you have expressed interest in because you're already working in other odd jobs doing that. And that's how you get people into full-time employment. And then they get off Medicaid. They're not trapped in the system. They go into the exchanges and they go up into commercial health insurance and they live fulfilling lives. I want to avoid the crisis that's been faced by many European countries, where in an effort to be nice, they give support to folks who then forget what it's like to work. If in the United Kingdom, which is a good example, you have generational trapped poverty, where your grandfather didn't have a job, your dad didn't have a job, you've never had a job, your son doesn't have a job, and no one you know has a job that you're related to. So it's not part of the culture anymore. In America, we always worked, and we need workers. So it's good for you, it's good for the country, it's good for the healthcare system.
All right, I want to turn my attention. You mentioned fraud, abuse, waste. When I think about Medicare Advantage, we've got serious problems there, right? The Wall Street Journal has had a number of stories that exploited, where companies are exploiting the system, collecting billions of dollars in taxpayer dollars. United Health just admitted that it was the Justice Department was investigating it. I feel like we've handed over our healthcare to a private industry and to ill effect.
So, Bob, this is a very sensitive topic for everybody because the whole point of launching Medicare Advantage was to give seniors options. You want to take a regular fee-for-service Medicare, which is out there and used by half the population, or do you want to use an HMO version, a managed care version that would, if theoretically, offer some benefits? They maybe do a better job in streamlining your care. They could give you supplemental benefits. They could help with your prescription pricing. They will give you things that would make your exercise classes, food support. And so Americans have sort of divided in half over this issue. In the middle of all this, if it turns out that Medicare Advantage is costing us a lot more than fee-for-service, you're violating the whole premise.
Right.
The whole argument was, we'll give a private company a little money if they drive down overall costs and improve quality. So if you believe the government does it better than anybody else, then stay with them. If you believe that a private venture, let's look at the mail system, right? You could use the U.S. Postal Service, you could use FedEx, right? So you have choice. And if you think FedEx is worth it, you give money to them. If not, you won't. In Medicare Advantage, I do think that there's been an ability for the private companies to game the coding system. And by that, I mean, obviously, if you're an insurance company, you want to know how sick your patients are. So instead of just saying, I got what I got, I'm going to take care of them, and I'll just be honest about how sick they are, they expertly devised tactics to upcode, to pretend the patients were sicker than they really were.
Right.
That got them more money. It got them shits that they can use for other purposes, and they were able to take profit off the table. We obviously are examining that. We have a process called RADV that allows us to go back into the late teens and for the first time audit Medicare Advantage companies. And based on what we find, we're going to pull money back from them. We expect it will be billions and billions of dollars.
Let me turn my attention, because I know we have short time, to Medicare Part B. The most recent trustees report suggests that Part B premium will rise 11.6% next year, and that we're projected to keep that percentage increases far in excess of average inflation over the next till 2033 or so. And some of it is due, I believe, because hospitals are now moving to outpatient care, which is a Part B cost, not a Part A cost. How do we rein in what's going on with Part B premiums? Because that obviously comes out of people's Social Security benefit checks.
So you have a very smart audience, but just we're all on the same page. I'm going to go through the letters real quick so everyone's together with us. So Part A is the 2.9% that comes out of everyone's paycheck every week that you get a pay stub. That pays for the hospital bill. A is in alpha. B is in boy, outpatient. Also some drug infusions like chemotherapy, for example, that's associated with hospitalization, done in a doctor's office or in the hospitals. Part B is in boy, doctor's expenses as well. Part C is the Medicare Advantage we were just talking about. And Part D, which we might talk about, is a drug. D is in drug, is the drug benefit that seniors are eligible for. So we have a major concern about Part B price increases, but we have a concern about Part A and Part C and Part D. So Part A, before I get to your question, the Medicare trustees report predicts it is bankrupt in 2033. Yeah. That's 3 years shorter than we thought even a month ago. And in their worst case scenario is that it goes bankrupt in 29. Now, we're not going to let that happen. But to fix that, you got to take some steps. And that's why some of the things we're doing are not popular with folks who get paid, not the beneficiaries, not the American people, but the folks who are getting paid from these programs are getting haircuts, and that's uncomfortable. Part B, which is what you asked about, is concerning because drug prices have increased so much. But there are other things that are in Part B as well that we believe we have control over and we could get to be more efficient. A lot of this is hearing the stakeholders and then pushing back on what you've heard, and then letting them actually come up with some ideas themselves. I had an op-ed this week with Marty Makary in the Wall Street Journal, and it talked about the power to convene. You mentioned prior authorization a little earlier. We went to all the major insurance companies, and we said, listen, we can do this with a sledgehammer and fix this issue that's frustrating the American people. The idea that you have to have all these prior authorizations for anything you want to do with your doctor. Or you guys can be adults and go fix this problem. In fact, the words we used was meek. You know, in the Bible, it speaks to the meek inheriting the earth. Meek doesn't mean weak, which is what I thought when I was a kid. Meek means you're armed with a sharp weapon, a sword, and you decide to sheathe that sword, put it away just for now, so you and your colleagues can come up with a better solution. So we're going back to hospital systems and drug manufacturers and the prior auth guys, the insurance companies who cover now 80% of the American people. In the case of prior authorization, they voluntarily came up with a nimble solution. They're being transparent in their efforts. They're dramatically reducing the number of prior authorization claims, and they're going to do it much faster. So you know almost immediately that you're not going to be stuck for 3 weeks waiting to find out if you can get your operation or not that's diagnosed cancer. So all this is part of the process. With the Part B program and with the Part C, a little bit with the Medicare Advantage, and even with Part D with the drug companies for outpatient drug use, we've gone back to all of them and said, we need better answers. And what you're doing now is making you a lot of money, and you can do that for another year or two, and then the bottom's going to fall out. So maybe you want to do it with us. Come work with us. Don't make us use a sledgehammer. Figure out these issues. Come to us with better ideas. Be transparent about them. The American people will love you for it. The president won't come after you because he will otherwise. And the president's very clear about this. He does not want the American taxpayers abused, and more importantly, doesn't want the American people abused. And some of these processes have become abusive. You know what works, Bob, really effectively? I will often go to a group of healthcare professionals, especially executives of companies, and I'll say, you went into this business because you care about people. Somewhere in your psyche, same as you did, Bob, when you entered the pharmaceutical space early in your career, you went into it because you thought these drugs would cure disease and save human lives. Sometimes we forget about that fundamental driving force. And if you can just align people, remind them that people matter more than profit statements, they get back to their root, that they want to brag to their kids and grandkids about how they made America better. This is a chance, a generational opportunity.
Yeah. So, there's a whirlwind of things going on. So Part B premiums are increasing, and then you mentioned Part A, where, according to the trustees report, there'll be about an 11% cut, perhaps, once the trust fund becomes depleted. So on the one hand, costs are rising, and services may decline on the hospital side if the providers experience an 11% cut. With respect to Part A, what's the solution there?
Well, I could talk about this for hours, so I'll give you a succinct answer. All right. So for-profit hospitals actually are bringing back mid-teens returns. Nonprofits are bringing single-digit low returns. Now, there's other reasons that may explain this, but at its very core, there are ways of making the system more efficient. And I think hospitals who are challenged, and the hospitals are the center of our communities, especially in rural America, which they're critical, and they're not getting much of the Medicaid dollar. Only about 7% of Medicaid money goes to the rural hospitals, so they get hurt badly in these programs. But at its very core, what these hospitals need to be able to do is use technology, which we're helping to launch on Wednesday at the White House with our effort to make America's health technology great again. It's an effort to make it easier for patients to interact with their doctors using their phones, letting doctors use navigation support so they can help with some of these difficult decision-making processes. Cancer drugs are changing so quickly, it's almost impossible to keep up. So how do we use the same technology that lets you pick the best video to watch tonight based on what you saw yesterday, use a rideshare technology, use Airbnb technology, use modern tools that have made the banking system safer from fraud, waste, and abuse, and allow that all to play out. It starts with two fundamental realities. You have to know who your customer is. So we've got to be able to allow the American beneficiaries to validate who they are, and then allow the system to talk to them with their medical records. And you also have to get doctors to tell us where they practice and who they are. Don't replace the doctor. Use AI to expand the doctor's opportunity. Allow them to use AI to do the intake so they pick up subtle problems with your emotional issues and how you're not taking your meds and why not and the other issues of your life. Give it to the doctor in an organized fashion so that when they're with you, they actually give you answers. They're not just listening to you.
All right. You already answered the question I was going to ask about AI. Try this one. A federal judge recently blocked a rule that would have removed medical debt from credit reports, and that would have helped maybe 15 million Americans. So curious, how do you respond? And what's your message to patients who might be stuck with debt that is affecting their credit reports?
Number one cause of bankruptcy in America is a health issue. Number one. And the number one driver of aging, it turns out, are financial issues, if you include things like divorce, which often present with those kinds of catastrophes. So we have to deal with the medical debt problem, which dwarfs all of the debt that we have. We also have to deal with it by reducing what it costs to get care in America, and by empowering people to know what it's going to cost. The No Surprises Act did just that. We just never actually enforced it. So we have laws now that are out there to protect patients that have not been used, and hospitals should be able to tell you ahead of time what it's going to cost. You should be able to choose accordingly. We should have protection on some of these expensive drug platforms that you might not realize you're walking into. But the American people are powerful if you arm them with information. Interestingly, the healthcare marketplace really isn't a marketplace, because in a marketplace, you have willing parties with full information flow, right? You don't buy stocks in a vacuum. You know a lot about the companies, and it's mandated, and then it's also enforced. We don't do that in healthcare. That's one of the big opportunities with the digital transformation of the system. Because once you have transparency, you'll say, just that hospital across town charges half what they charge at my hospital for an MRI scan. I'm going to complain to my doctor. And guess what happens? The doctor calls the hospital administrator. They drop their MRI costs. The whole system does better.
Yeah. So last question, Dr. Oz, I know we're on a short time here, is you ran for Senate in the state of Pennsylvania. You're now head of CMS. And is politics in your future? Do you plan, after your stint here, another run for office, governor, something else?
I literally go to bed at night trying to think of what I'm doing tomorrow. I haven't made vacation plans. I almost missed my wife's birthday, so I've got much bigger risks. As I started this interview off and I am with it, I'm in the change business. And right now I'm in the best place, I believe, on the planet for me to be, to try to help make these changes. I'm surrounded by brilliant individuals who are mission aligned. I have a president who's spectacularly desirous of making change, and a Secretary of Health and Human Services, Bobby Kennedy, who's a superstar, both as a personal friend, but also as a mentor, just wants to push for us to be bravely in front of a lot of the issues plaguing the American people.
All
So
right, I
that's
lied.
my
Last
laser.
question. Last question is this. I know you recently enrolled, I believe, in Part A in Medicare. Is that right?
Very, very. Yeah, thank you for clarifying that. I enrolled in Part A because I have health insurance that you're paying for. The
That's
government's paying
creditable,
for, but
right?
that's correct. But Part A, you should all sign up for. It doesn't cost the government anything because if you have other insurance, the Part A will be in the background.
Yeah. And then, all right, I lied. One last question. I watched your video. Wait.
I know. I know.
I know you
I
just.
know who your producer is. She's the same producer I had.
I know, but actually, this is my own question. I just watched your video on hospice scams. And I just take a moment to talk about the need for adults to protect themselves against scams that could put their Medicare number at risk.
Bob, this is a reprehensible activity. It's run by criminal syndicates. These are not small-time operators. They take advantage of people at their most vulnerable time. It takes a lot of gumption to deal with hospice issues, to make it a choice, a decision that you're done with the traditional pathway and you're reconciling to what might happen, and to allow you, therefore, to make some bold steps like joining hospice. So our hope, our desire is to make sure that's a clean and safe process. The reputable hospice teams are coming to us, companies, and saying there's a lot of fraud out there. We're hearing all these horror stories about people who thought they were entering legitimate hospice and there's nothing there for them. And even worse, because you're not really sick, people are on these hospice programs for years. And so we're going after them in a big way. We already have actions in several states. The Department of Justice is pursuing a lot of these leads. We will leave no stone unturned. There is a new sheriff in town, I promise you. If you're cheating the American people, we will come after you. And if you're doing it to hurt folks who are most vulnerable, we'll be doubly vigilant at that.
Dr. Oz, thank you ever so much for chatting with us, sharing your knowledge, your wisdom, your insight. That's greatly appreciated. Thank you.
God bless you. Take care.
So what do you think of what Dr. Oz had to say? I'll tell you what I think. A lot of questions, a lot of unanswered questions, and a lot of questions still to be asked. And that's our goal here on Decoding Retirement, is to keep asking the hard questions and provide you with the information that you need to plan for and live in retirement and plan for those healthcare costs in retirement. We hope you enjoyed this episode of Decoding Retirement. Thanks for listening.
This content was not intended to be financial advice and should not be used as a substitute for professional financial services.